Good evening and welcome to IHW Council's special web series on women's health, START, supporting treatment in assisted reproductive therapy. I'm Anisha Nayyar and you're watching our exclusive show on women's health supported by Bharat Serums and Vaccines under its public awareness initiative. The COVID pandemic has put the spotlight squarely on our health. The arrival of the vaccine and the start of the inoculation process has brought hopes to millions of people who want to stay safe and return back to their pre-corona days. But there are many who find themselves in despair as some of their dreams have suffered a setback because of the many restrictions of the lockdown and the fear about COVID-19. I'm talking about couples who dream about starting a family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that many young couples have been facing. According to the Indian Society of Assisted Reproduction, infertility currently affects about 10 to 14% of the Indian population. The scenario is worse in our cities, where 1 out of every 6 couples is impacted. Our show today is very special, and we're going to talk about the different aspects related to fertility and IVF treatment. Bharat Serum and Vaccines Project START is an initiative that aims at supporting couples beyond medicines with initiatives like microfinancing and treatment and counseling. The Project START encourages couples to stay on course for IVF treatments to achieve the goal of parenthood. Today, we will be discussing choosing the right infertility treatment for you, IUI or IVF. There may be many questions that come to your mind on this topic or anything regarding infertility and how you should succeed in starting a family. On our show today, we have an expert joining us to help answer all your queries. Please welcome Dr. Monu Pattanayak, Director, Shanti Memorial Hospital, Rourkela, Odisha. Thank you so much, Dr. Pattanayak, for joining us. Dr. Pattanayak has 36 years of experience in this field, out of which he has spent most of his years in the field of IVF and infertility treatment. He specializes in infertility treatment and conducts various sperm retrieval procedures. Before I begin this conversation, I would like to request our viewers who are watching, who are hearing us now, to send us their questions. You can just type it in the comment box, and on the next 30 minutes, we will try to take in as many questions as we can. This is your golden opportunity to get your questions answered by an expert who is joining us live on this show. Do like and comment with your feedback, and also share this special show on your wall if you think some of your friends or relatives could benefit from it. So let's begin, Dr. Pattanayak. When we think of infertility treatment, most people think of test tube babies or IVF. So is that how fertility treatment happens? Is it a step-by-step process? Are there other procedures that could also help, not just IVF?
See, first of all, people conceive. If you expected management, if you leave, most of the people will conceive after 2 years of unprotected intercourse. There is a big chunk of people, they conceive. They don't need IUI or IVF. We just totally forget in this modern world the expected management. Then those who really need, particularly the subgroup of patients, those who are unexplained infertility. So they are the things, or mild factor in male infertility, they are the things they need little assistance. The assistance comes in the form of counseling, time sexual intercourse, any other difference between the husband and wife about their marital life and coital history. Then comes question of IUI. IUI should be very selective cases to be done. So if you do IUI in a selected group of people and do methodically, then the chances of failure is very low.
Mm-hmm.
And
okay. Dr. Pattanayak, I want to try to understand how we go about this. You're talking about IUI, but there is a problem, which is why of infertility in our country, which is why we see many more clinics come up. And I'm sure everybody is not so naive that they don't know about timed intercourse, or they may be busy. They may not have the time to do this, so they then look for other scientific ways to, get on the road to parenthood. Now, when I see fertility specialist, if I've been trying and I've been unsuccessful, what are the first things that I should keep in mind to speak to the doctor? Because the doctor knows the procedures, what is to be done, and what is an IUI, what is an IVF, who is it suitable for? I don't know. So,
Yes.
what is it that the patient should keep in mind if
When you
things
see
like timed intercourse and all has not worked?
Yeah. When we see the first couple, we always evaluate them. We see how many years of marriage, what is their age, what is their background, if they have got any comorbidity. And then once we evaluate, if we find their tubal structures are normal, their reproductive systems are normal, they have fairly good their endocrine levels, and they are less than 35 years of age and staying together frequent weekly twice or thrice they stay cohabiting. I don't think there is too much to rush in for infertility treatment or to put them in their mind that you need to have some kind of special treatment. They need to be counseled, and there you categorize if these patients need to be given expected management or some simple therapy like IUI, or if they think that yes, it needs further evaluations, further testing, then the IVF or other methods to be accepted and to explain to them how they accept it. But my point of telling you that today's world, particularly the way things is moving, everywhere in the world, now they are facing the same problem. That we are, as an IVF specialist, we are mustering up, making so many clinics and so many treatments, and IVF specialists we boast, and we go from our ethics, go beyond. Now the question still lies with us. Is always necessary, IVF is necessary. Even to the best center in USA, they think you can do good IUI, even good expected management, then you can reduce the patient to go for higher thing like IVF, ICSI or other things. So now we have to all think in ourselves that are we doing the right kind of thing? We are intervention in the right time. Is it good for our patients? Is it good for our science? This is now the questions which has come up.
Right.
We have to review ourselves.
Yeah, so you've spoken about the question of science and the question of ethics. Now, as a regular person or a lady looking to conceive, what I want to understand is what is the difference between an IUI and an IVF in terms of scientifically, how is it different? How does it feel to get it done for a couple? And what is the differential in the pricing between, say, an IUI-like procedure and an IVF procedure?
In IUI is a very simple thing. We collect the semen, we process in our laboratory, see the how much total motile sperm is there. Accordingly, we decide by the swim up method or swim down method or just simple layering, or we do gradient method, or nowadays new generation thing, microfluidic and other things are there. So these are the things we only see when we see the simple their semen parameters. If we see the semen parameters are normal, if the wife's tubal patency is good, she is ovulating regularly, then there are certain segment of patients that's called unexplained infertility. So there may be counseling, time sexual intercourse, and maybe little processing of the semen and some ovulations like ovarian stimulations will help this segment of people to conceive faster.
Right, but you're saying that this segment of people are generally, they're basically fine. You're saying the tubes are fine, the sperms are fine, they're also having intercourse, but they're still not able to explain why they can't start a family. So this is where an IUI helps. What does the IUI, what is the problem that it overcomes in this process?
See, there are certain cases with mild, subtle male factor will be there. Maybe some antibodies, maybe some sperm DNA defect. So these are the few things where we can sort out the best sperm and do timing things. And maybe that couples may not be aware when and how to stay, and they will be more concerned about take out their stress, come together. They should be more focused. Yes, they want to go for baby. So this kind of processing and doing also educate the couples to be more serious about going for baby.
Mhm.
And there will guide them. And yes, if necessary, as I told you, there is some problem with the ovulations, then that can be corrected by ovulation inductions. If there is some mild factors, because the semen analysis from 18 millions to 80 millions, so there are some changes. So these some mild male factors can be corrected by doing sperm processing, different type of sperm processing. This sperm processing may help the sperm, concentrating the sperms, motile sperms, and putting in the right time in the proximity of the egg when it comes out in time. So
So
we
this
time,
is the science of the IUI.
yeah.
For a couple who's struggling, what is the procedure like? Does the patient have to be admitted to the hospital? How long does it take? Can you tell us how does it feel for a patient?
Yeah, if we have to do IUI, the setting should be that laboratories should be equipped to process the semen analysis in a scientific way. It should not be taken lightly because this is the germ cells. As we give importance to the egg, we should respect the sperm. People take it that lightly. Oh, sperm washing is done, you put it, centrifuge and put it. That's not the like of doing IUI. IUI should be done preferably in IVF setting where the incubations and processing to be done, and the once there is a collection within 1.5 hours, the IUI should be conducted, and the IUI should be conducted in the fashion that should be non-traumatic, and the patient should have time to rest for a while, and then they, if necessary, sometimes we give some support to them, either some luteal support or something if it's necessary. So these are the things to be done. It should not be done in general clinic. Then we don't give that scientific principle. We always compromise there. So
So what you're
ideally, it
saying
should be
is,
done.
in the couple, the male goes and gives his sperm, within the clinic. Then the sperm is taken, it is treated in a good lab in the same place, and then this is given to the woman. How is this given to the woman? What is the procedure she undergoes? Is it painful? Does she have to be admitted? This is what I
No, no,
wanted to
no,
understand.
exactly not. Just like a pelvic examinations as we do, it's not a painful thing. Patient is explained to the procedures. Then we take semen sample, we take in a smooth, soft catheter. We non-traumatically we put in the cervix. Of course, we before that we should take the history. If at all any other problems, he had got vaginal problems or cervical problems or something, then most of the time it is a very atraumatic procedure. It goes. Sometimes some help is necessary. There may be some obstruction, their cervix or something. They are little dilated or some other help. Maybe some more persuasion is done. Very rarely we use any anesthesia for this kind of things. And it's a simple procedures. After processing, we put in the catheter in the right place. Very rarely we take ultrasound guidance to see the catheter is in the right place or not. But not in IUI cases, we usually do those kind of things.
So you're saying
But
you just use a catheter to place the washed semen, which is the best of the sperms, into the woman's uterus. So
yeah,
what was a natural process has just been refined upon, right?
exactly.
Okay. So now I want to understand who is the best candidate for an IUI and who is the best candidate for an IVF. It seems to me that if there is a mild male factor problem, an IUI should be very effective. For IVF, who's the best candidate here?
If you have the age is more than 40 or more than 35.
Of the female? Age of?
We're talking of female.
Okay.
And the patient has tried 3-4 times IUI. There is a male factor which is not been correctable. There is something more, the total sperm count is less than 5 million or 2 millions. There we cannot take chance with IUI. We should directly tell them to go for IVF or ICSI. But those who have tubal factor or comorbid factors like severe degree of endometriosis, severe pelvic inflammatory disease, so those cases we have to directly go, because we should not waste that time, because the age takes out whatever their ovarian reserve is there.
Mm-hmm. So we go directly to IVF in this case.
Yes, exactly.
Okay, we have started getting a few questions. So I will start taking those questions. A Facebook user sent us a question asking, what are the parameters on which the success of IVF or IUI depends? What parameters determine the success of both these procedures?
If you take the semen parameters, when we do the total motile sperm count, if it is less than 2 million, then we always ask them to directly go for IVF. If it is 2 to 5 million, they can try few cycles of IUI with good ovulation inductions, maybe gonadotropins with gonadotropin stimulations. Then above 10 millions, they should go for at least 4 to even people go for 6 cycles of IUI. Okay. The tube should be patent.
Okay, so you're saying that the tube should be open and there should be no other factor, and that should give relative success for an IUI. And the question for the IVF perhaps is coming because everybody says that IVF is not perfect science. It's not 100% sure कि आज हमने cycle कराया तो कल baby मिल जाएगा.
No.
So what are the parameters that impact the success of an IVF?
For IVF, again, the selection of patients, assessing their ovarian reserve, seeing their uterine receptivity, uterine cavity, and other factors is there. There's KB, hydrosalpinx, or associated very severe degree of endometriosis. These are all the things which decreases the success of IVF. If we take care of that, we discuss with the patient, these are our chances of success, and then we choose that we go for IVF or go ICSI. So there, the semen parameter, these other factors, particularly those who are having very low count, those who are cases where we are testicular sperm or epididymal sperms we are using, there we cannot think about IVF. We have to go immediately ICSI or MC or anything, what we do. So the very important thing, if your IVF selection is the age criteria, any comorbidity, and previous IVF failure, or they have done, or they are very impatient. Mm-hmm. So their group of patients nowadays is forcing us that we are 40, we are not staying together, we cannot give semen sample, and this we want this. So these are the different segment products, though ethics comes into the picture, but sometimes we discuss with them because of this modern world and stressful world.
Right. We have another question coming in, Dr. Pattanayak. The Facebook user is asking, does IVF lead to multiple pregnancy, and how is it better than IUI?
Yes, this is one of the things that's very, very difficult for us. We are sometimes very greedy. We stimulate the patients. We even more than 1 egg, with 2-3 eggs we go. Still in IUI is acceptable 2 or 3 eggs. But beyond that, if you have stimulated by ovarian stimulations, if you do in that cycle IUI, then chances of multiple pregnancy is there. Which is
even in IUI?
It is in IUI. IVF, you are putting it, single embryo, double embryo, it is in your hand. But in IUI, it is not in your hand. You have already stimulated the ovary is hyperstimulated, then you are putting the sperms. The sperm can either a zero pregnancy or can be 5 pregnancy. So there the problem. So there we
So
have
you're
to
saying is because during stimulation there are multiple eggs. So when you put the washed sperm, perhaps more than one could fertilize and implant. So then there's a chance of
chances. Yes.
multiple
So there we
pregnancies.
have to take a decision. If it is more than 2 or 3 eggs, then better to avoid insemination in that cycle. So that kind of restraint we all infertility specialists should practice. Otherwise, multiple pregnancies are very, very, yes, twins people accept it, but beyond that, triplets or quadruplets is a very difficult thing.
Right. So another user is asking, and it's related to this question, do multiple pregnancies lead to risk in IVF? I'm trying to understand risk to the mother, risk to the procedure, risk to the baby, but
multiple eggs is risk to the patient as a hyperstimulation syndrome, and risk to the pregnancy when carrying on. That causes more miscarriage, more problems during continuation pregnancy, bleeding and other things, and can have hypertension, comorbid problems, and premature delivery. And premature delivery is a really problem for the baby. They can have a lot of neurological and long-term sequelae to the baby. So there, everybody now is very, very single-term pregnancy and single embryo transfer in IVF. Now that's the go of the world. Even twins pregnancy people are also scared now.
Okay. Another question that we've received is Dr. Pattanayak, a Facebook user is asking, can fibroids negatively affect IVF success?
Which one?
Can fibroids negatively affect IVF success?
Depend upon what are the types of fibroid. If it is intracavitary or it is type 1, type 2, type 3, these are which is projecting into the cavity, or it is the intramural, more proximity to the endometrium, the size is more than 3 centimeter. These are problematic for continuation of pregnancy. Otherwise, subserous fibroid or type 4, type 5, it doesn't usually interfere with the pregnancy continuations. There, when we are doing a pregnancy, we are doing cesarean, we see a lot of fibroid there, we take out, that usually doesn't interfere.
All right. Another question that we've received, Dr. Pattanayak, is after the first dose of IVF injection, the egg ruptured in 9 days. What could be the reason? And if the egg ruptures in 9 days, is it bad, or does it affect the cycle negatively?
Yes, in the 9th day, egg coming out, the type of maturation of that egg is a little problematic. Usually, after 10 days or 12 days, egg is acceptable. But before 9th day, if it is the egg, a follicle or a cyst, is very difficult to know. So 9th day of menstrual cycle, egg coming out, I won't be very hopeful for normal pregnancy.
So then you were saying in that cycle, you will then advise the patient not to go for the transfer and then delay to the next cycle. What is the then solution?
Yeah, because I want to observe that cycle. I want to see, do some parameter. I have to see those people, those who have early follicle development, we have to see the cohort of the follicle, see their ovarian reserve. Maybe we have to do certain hormonal test, the level of E2, how much E2 or how much progesterone in that in the proliferative phase. Then we can assess the next cycle, how we will monitor the cycle, how we will do medicines for ovulation inductions.
There's another question coming in from a Facebook user who's asking, is it possible to get IVF after 50? What are the risk factors involved?
Nowadays, people are coming at the age of 50 for IVF for donor. Now, there is no bar. Only thing is we have to talk to them, explain them. If they carry at the age of 50, there is other problems they have to sort out. And we have to explain them either going comorbidity and other things. Otherwise, a ovum donation cycle up to 50, we can carry it out. But explaining the risk of that age pregnancy to continue.
Sorry, ovum donation is, you're saying that somebody else's eggs can be implanted? Is that what you're saying?
No.
Okay. All right. So, Dr. Pattanayak, could you also tell us what is the difference in the cost and the pricing between IUI and IVF?
Yeah, if you take 3 cycle IUI, which costs same to the 1 cycle of IVF.
Okay. So approximately, say in Odisha, in Rourkela, how much would it cost? Say 1 cycle of IVF.
IVF will cost from 60,000 to 1 lakh rupees.
Right. So, Dr. Pattanayak, then is this a step-by-step process? When I come to you, I get counseling about timed intercourse. Then I go for 3-4 cycles of IUI. If that doesn't work, then I go for an IVF. So, is this a step-by-step process?
Ideally, one should do like that. If there is no other birth, as I told you, if you find there is a tubal factor is there, the ovary reserve is dwindling, the age is going out, you cannot just carry on IUI.
IUIs, okay. So once those parameters are in place, you take that call. Another question that we've got is, what is the risk of donating eggs in IVF? Again, this question is a little...
Yes, there are people sharing of egg, the people are coming up and asking their relatives to come and donate their eggs. That we are also taking. So there is a things, yes, we have to maintain the legality of this and explain them. Those who are donors, they have to also win respect, and we have to take care of their health also. Then if somebody comes this way.
So the risk of the person receiving the egg, is there any risk there? This is what I wanted to understand.
No. Those who are receiving the egg, they don't have problem if you have taken care of the HIV and other things, all rest is done. I don't think that is anything.
Which is usually done, right? These tests will be run, right?
Yeah, that should not be hereditary disease or disease, and the things we sort it out before that.
Okay. And if, egg donation in the same family has happened, are there any contraindications in terms of the same DNA, etc.?
Egg donation, the same family gives, because the egg after all is coming from one person. The sperm will come from the husband's side.
Okay.
There's no problem.
All right. Dr. Pattanayak, thank you so much for joining us today and discussing with us the different aspects of IUI versus IVF. Who is it suitable for? What are the parameters that determine the success of either of the procedures? And of course, what it feels like for the patient undergoing an IUI. And of course, the cost differential between the procedures as well. Thank you so much for joining us this evening.
Just my last word is, we should not hurry up for IVF. Too much now, this bring up IVF. We should be very judicious. We have to see where it is applicable. And if you put it in the right place and right persons, then both our ART treatments will be very acceptable to the people and they will give credit to us.
So, Dr. Pattanayak, is this advice for patients or is it for the medical community?
For everybody. For everybody. And the patient should not jump in. Should not be restless that I want baby, just give me a baby anyway. So we should always tell them, we can explain them, they can have patience and they can get in easy way.
All right.
Expected management is still the goal of the world. We should not forget that part of it.
All right. Thank you so much, Dr. Pattanayak, for joining us and sharing with us your expertise and your opinion on infertility treatments and what is most suitable for different kind of patients. So that is Dr. Pattanayak answering your questions on fertility and IVF treatment during COVID-19. Now, if you have any more questions, you can send them to us through our WhatsApp button. You just have to click on the WhatsApp button on the page. Also, don't forget to follow us and stay updated on all the concerns about your health and well-being. This program was supported by Bharat Serums and Vaccines Limited under its public awareness initiative. We'll be back with our special show on women's health next week at the same time. Do follow us on Facebook to get all the updates on our upcoming programs. So keep sending us your questions and we'll certainly try to include them in our next show. Till then, stay at home and take care. Goodbye and see you soon.
Thank you very much.